Hi, everyone. Welcome to Locating Community-Based Resources, hosted by Sara Tribe Clark, Director of the Eldercare Locator, which is administered by N4A and is a public service of the U.S. Administration for Community Living. Thanks for joining us.
And Sarah, whenever you're ready to begin, go right ahead.
Okay. Thank you so much. I'm Sara Tribe Clark, Director of the Eldercare Locator, and just making sure, can everybody hear me okay? Hello?
I'll ask in the audience chat. If everybody can hear, please write yes in the audience chat box.
Oh.
Yes.
Okay.
Getting yeses, so please go ahead.
Yeah. Okay. All right, so I too am still getting used to the remote, webinar. So thank you so much for having me. I'm so glad to be here. I just wanted to give a quick little blurb on my background. My whole career has been all about home and community-based services, and I've worked in the fields of aging and disability services since my first job out of school, and back in 2001 as a camp counselor for kids with special needs. I've worked with the Eldercare Locator at the National Association of Area Agencies on Aging, or N4A, since December of 2019, so not too long. I've been using the Eldercare Locator to help connect friends, family, and caregivers to their local resources since I learned about it, so that's at least a decade or more. Before that, before my current job, I worked at the District of Columbia's Aging and Disability Resource Center, and I had several different roles before that within the Massachusetts AAAs, area agencies on aging, there or aging service access points. But I was a program manager for several different Medicaid programs for both older adults and people with disabilities. I was a case manager at a different ASAPs before that, and a social work intern as well in the Boston area. I was a program manager at a group home in Massachusetts. That's where I got my start in understanding the services and gaps in support for several people who lived in the group home. They had CP, and I kind of got my introduction to the Massachusetts world of disability services. So that's just a little bit of background. And moving to the next slide. So today we're just going to be talking about an overview of the National Aging Network, N4A, the Eldercare Locator, and how we can help people of all ages and abilities and their caregivers as they access a wide range of locally run community services and support. I'll also review several of N4A's key responses to the coronavirus pandemic. Seems like that would be remiss to not mention at a time like this, certainly. So for over 25 years, the Eldercare Locator has connected older adults and their caregivers to critical local services and programs. The Eldercare Locator is a service of the Administration for Community Living, administered by the National Association of Area Agencies on Aging. Again, I'll be referring to it as N4A throughout the presentation. N4A is a membership association representing America's national network of 622 area agencies on aging, and I'll be saying AAAs, throughout the presentation, and providing a voice in the nation's capital for more than 250 Title VI Native American aging programs. This network was established under the Older Americans Act as organizations charged with helping older adults live with independence and dignity in their homes and communities. Since its inception, reauthorizations of the Older Americans Act have expanded its charge to include, in some cases, people with disabilities, and over time, most AAAs across the country have also expanded their work to include serving people with disabilities as well as older adults, with a focus less on diagnosis and more on self-identified need for accessing home and community-based services. So again, the National Aging Network is comprised of 622 AAAs serving older adults and people with disabilities in virtually every community in the nation. In a few comparatively small or sparsely populated states, territories, and Washington, D.C., the State Unit on Aging serves as the AAA function. The Older Americans Act is foundational for all of the AAAs, providing both regulations and funding though each AAA really adapts to the unique demands of the community. And we really are seeing that, especially now during COVID-19. There's just so many adaptations and creative things happening. I'll be talking a little bit more about in response to the immediate need and the ways that it's affecting communities uniquely. So many AAAs have additional funding sources, though, not just the Older Americans Act funds, as they provide programs and services such as Medicaid, cost sharing for certain services in some cases, and also receiving revenue from fundraising, just to name a few alternate funding sources. So to ensure responsiveness to the rapidly changing needs of their communities, all AAAs are involved in planning, developing, coordinating, and delivering a wide range of services and supports in their respective local planning and service area. Partnerships, critical to AAAs, and many work with other aging and disability-focused organizations. For example, Aging and Disability Resource Centers, Centers for Independent Living, State Health Insurance Assistance Programs, or SHIPs. These are called lots of different names in your various communities, but the services are very similar. State Alzheimer's Association chapters and other community-based organizations in the implementation of program services. So I'd love to get a sense for how many of you on the call today partner with or have accessed services through a AAA. If you could just use the chat feature on our virtual platform to respond, it would be helpful. And I'm going to just pause after the next slide and try to get a sense for the answers. All right.
Sarah, can you repeat the question again?
Sure. And I do see in the chat there's some difficulty with hearing, or at least a couple of people have mentioned that. Are we okay, you think, going?
Yes, I provided, again, the dial-in number if they want to call in by phone if they're not getting audio streaming through their computer.
Okay, thank you. All right, and I'm seeing the answers now rolling in, but the question was, I'd really like to get a sense for how many of you on the call today partner with or have accessed services through your local AAA or the AAA of someone that you are a caregiver for, if you're a professional or a person with a disability. If you could just use the chat feature to answer that. All right. Great. So combination for sure. I'd like to get a sense. Some AAAs on. Hi, AAAs. Ombudsman, great. And some people already have doing frequent referrals to AAAs. Oh, from an ASAP, Massachusetts. Hi. All right. Great. All right. Well, I'll be glancing at these now that I know how to see the results. I'll be glancing at these as we go along. So it seems like we definitely have a lot of partnership and interaction already. Hopefully, many of you on the call already are familiar with the Eldercare Locator and have been using it, but I'm just making sure. I do see that some folks have not been in contact yet, so I just want to make sure that we're all up to speed because there's just so many great things and important services that you can access through your local agencies. All right, so moving right along. Here are the 5 core services on this slide that AAAs are authorized by the Older Americans Act to offer. So as I talk through these, I'll mention some of the ways AAAs have adapted throughout the coronavirus pandemic, as nearly everything that AAAs do have been affected, everything. So elder rights programs, which include elder abuse prevention programs, long-term care ombudsman programs. The long-term care ombudsman programs, I see some of you on the call are either with ombudsman programs or certainly use them frequently, but as you can imagine, they've had a much higher volume of calls during this period. They advocate on multiple levels for residents of adult care facilities, generally nursing homes, board and care homes, assisted living facilities, but in some cases also in some states for Medicaid-funded home and community-based long-term care programs as well. So they work to resolve problems, individual resident space, and advocate for change at the local, state, and national levels to improve quality of life and care. So the Eldercare Locator staff has been making much more frequent referrals to long-term care ombudsmen the past couple months as obviously if loved ones are seeking access to residents of nursing facilities during the COVID-19 pandemic. Supportive services, including in-home assistance, case management, transportation, home modification, and legal services, just to name a few. Due to COVID-19, while there has been marked reduction of services in some cases due to smaller workforce, a lot of caregivers are having to take care of their own family members or become sick because of the in-person interaction that they're having, and many people not feeling comfortable with workers entering their home to assist them. AAAs are still scheduling in-home assistance for people in greatest need. In fact, some are still providing services at pre-COVID levels or higher. AAAs are still connecting people to local transportation options for medically necessary rides, so this varies significantly by location. So again, anything I say on this webinar, make sure you're checking in with your local AAA. They may have more or fewer services than what I'm talking about. Nutrition programs include both congregate and home-delivered meals. Since March, AAAs have received significant federal funding increases for home-delivered meals. That's allowed them to, in some cases, relax eligibility rules. While all of them have closed down congregate sites, there are many innovative things they're doing, like grab-and-go meals, having staff members who used to work at congregate sites kind of repurposed in other positions, and helping with the often hugely increased number of home-delivered meals that they're getting out there. So if you or someone you assist is under 60 years old and needs help with home-delivered meals or grocery delivery, please still check in with your local AAA and see if they can assist, especially during the COVID-19 crisis. And during other times, we'll talk about it later in the presentation. But even if you have a sense that it's not the same range of help that a person with a disability who's under 60 could get, it's still definitely worth checking in, because if there are resources, your AAA will likely know about them. Most AAAs have shifted to some form of virtual programming and support for the last two. There's two more in our Older Americans at Core Services list here. So programs for caregivers, that could include respite programs, support groups, and various types of training for caregivers. And the latter two are the ones that would likely be switched to virtual programming. And health and wellness programs. Obviously, again, lately the senior wellness centers are going to be closed down, exercise classes and the like, but most AAAs have figured out different opportunities for socialization and virtual connection to exercise classes and other programming to help people with reducing mental health related issues that are stemming from social isolation. So a final key role I'll mention, it's not in the 5 core services, but another key role of AAAs is to offer local information and referral assistance services to help people find aging and other home and community-based service programs. Just seeing some of the other responses, I feel like I'm having a little reunion here in the chat section. I'm so glad to have everybody on. It's such a relief to know that there's such a big safety net of folks out there working, even though we're all kind of in our own homes probably in many cases. So moving on to the next slide. So Aging and Disability Resource Centers, I just wanted to pause there. I see many of you are either partnering with a ADRC or from an ADRC, or maybe a combination of a AAA and ADRC. So Aging and Disability Resource Centers across the country seek to address the frustrations many older adults and people with disabilities and family members experience when attempting to access long-term services and support, especially when you're first trying to figure them out and it just seems overwhelming and it's hard to figure out where to start. So Aging and Disability Resource Centers, or ADRCs, the initiative initially is a collaboration, an effort of the U.S. Administration for Community Living and Centers for Medicare and Medicaid Services, or CMS, and the Veterans Health Administration. So there were several waves of grant funding since 2003, including funds built into the 2010 Affordable Care Act that have supported the development of ADRCs and helped weave them into the fabric of what used to be a sole focus on aging, but now it's kind of morphed as the AAAs have done more and more with home and community-based services. So while states and organizations have been given the flexibility to determine exactly how ADRCs will fit into their home and community-based service structure, and ultimately how and if they'll be funded once the grant funding ended, they all have a common set of practices, which are providing objective information and assistance, generally through an information and referral call center, raising awareness about the full range of available options, empowering people to make informed decisions about their long-term care services and support, helping people access public and private programs, and also ADRCs provide assistance to people at all income levels. So as noted earlier, AAAs have expanded their original scope from specifically older adults to more general home and community services in many cases. So their scope has expanded to include people with disabilities and people under age 65 in many cases. So the majority of AAAs are actually housed within AAAs, and you'll see this. I'm going through all this explanation. It does tie back to something. You'll see this reflected in the Eldercare Locator website database listings. So when ADRCs are listed for a particular area, their contact information is frequently identical to AAAs. So I'll be going over some example of this later, and that'll kind of help explain why for people who are newer to the scene and kind of working through all the acronyms. So the second most likely location for them is for ADRCs is within Centers for Independent Living. Oops. I'll try not to say oops every time I change the slide. All right, so before I jump to more details about the Eldercare Locator, I'm just going to review some of the actions that N4A has taken in response to the COVID-19 pandemic. So we launched a resource page on our website. It's at n4a.org, as the slide says, /COVID-19, where people can find several helpful resources, such as our weekly COVID-19 e-blast on national resources and notes from the field, and also podcast-type interviews with AAA directors from areas of the country that have been the hardest hit initially with COVID-19 to help guide the other places that are able to adopt some of the best practices that provide insight into best practices on how to respond for those parts of the country that the pandemic is affecting slightly later. There's several webinars in partnership with other organizations. One example of a webinar is N4A did one on securing the Paycheck Protection Program loans from the Small Business Administration in partnership with the Ohio Association of AAAs. This was one example, but I encourage you to go onto n4a.org and see some of those resources. And just a few quick examples. You know, I see so many AAAs are on, but just to give some examples about some of the creative things that are happening. So in Spokane, Washington, telephone reassurance calls to vulnerable older adults have been taking place via a partnership with Washington State University's nursing program to determine how people are coping with stay-at-home orders. They're able to flag people who need follow-up, either with the AAA staff or with additional resources and support, or with ongoing reassurance calls. So the AAA in Charlotte, North Carolina has closed all local senior centers and congregate meal sites, as everywhere, but for the state mandate, and to utilize the expertise and relationships the staff in those sites have already established. The AAA staff who normally work at those locations are now making telephone reassurance calls to check in with those same older adults they may normally work with. So this AAA has also been distributing educational materials on eating healthy, ways to exercise indoors, and general information on COVID, along with home-delivered meals or through the mail. And that's something we've seen at many AAAs too, especially that getting information out there to people in a way that they're likely to see and read. And then finally, nurses from another AAA closed their adult day health facility are now performing remote health and wellness checks for older adults in the community. So this AAA has also partnered with their local Jewish community center to have its social workers and recreational therapists provide virtual exercise classes. And of course, you may be asking, well, older adults, are they on the internet that much to be able to do Zoom meetings? So there's also many examples of AAAs providing tutorials and helping older adults in the community learn to use that platform, Zoom and other types of virtual meetings. All right, Eldercare Locator, just want to highlight a few of the things that we've been doing as well separately. We've been working on two flyers, or we have two flyers out there, which I'll go over a little bit later in the presentation. But we've developed a flyer in partnership with N4A and the Alliance for Aging Research to provide clear information about COVID-19 and then direct people to the Eldercare Locator to get to their local agencies. And the second flyer in partnership with Engaged, one of N4A's programs that appropriately helps older adults, stay engaged during the COVID-19 pandemic. So we have a flyer that actually lists the technology-based and non-technology-based ideas that people can do to stay engaged, even being at home. And we have several points within the flyer that refer them to the website where they can find even more ideas. And we keep that updated through a blog and on the website as we're getting in great ideas from AAAs, which are just rolling in all the time because they're just doing so many innovative things. So we've also shifted the call center to 100% telework as of March 16th. And we've established weekly staff meetings to help keep people on target. There's so much changing, fast-moving resource updates. We're just trying to make sure that we have, we have plenty of chances and trainings and making sure that everyone's totally up to date on all the changing information that's happening. We also developed a daily report to highlight trends in the volume of COVID-19 related referrals. And I'm sure, like so many of you are experiencing, most frequent calls have been related to either accessing food or funds. The stimulus check questions, there's been so many changes that people have had questions about in when they will receive their checks and what has happened to their checks. So we're doing a lot of work on kind of prepping our staff for how to answer those questions. All right, so moving on to the National Call Center, I guess we'll jump into the Eldercare Locator information. So on the slide, you can see our toll-free number and our website information. And I do encourage you to go there if you haven't yet. It sounds like many people may already have used the locator, but I talk a little bit about it. The Eldercare Locator runs a Washington, D.C. based call center, which generally operates Monday through Friday, 9 a.m. to 8 p.m. So currently we're closing at 6 p.m. Eastern due to COVID-19 related changes in staffing and telework. So over 4 million people have been connected to local programs and services through our national call center, and we are on track to receive our 5 millionth call this summer. Callers contact the Eldercare Locator from all 50 states, DC, and most U.S. territories. And we now have an after-hours voice prompt system that allows callers to connect directly to local agencies, even outside of office hours. So it's really greatly increased our ability to help more people, especially those who call and need assistance outside our regular office hours. So like other information and referral teams, both on this call and other spots, our INR team, we're AIR certified information specialists, answering phone calls, emails, texts, and web chat. We use a customer relations management system to document all calls, and we search our database for resources to respond to calls and emails. So while we collect aggregate contact information, we don't collect any PHI or other identifying client information. Just for a little background, AIRS, or the Alliance of Information and Referral Systems, it's a professional organization for INR specialists. The Eldercare Locator team works closely with AIRS and uses the AIRS standards as the foundation of our call center's functioning and structure. Specialists go through the AIRS certification process. Again, like many of you on the call, that I can see after 1 year on the job, we require that people at least sit for the exam, and then we support them in making sure they're able to get certified. And while some calls are quick referrals to a local AAA, often Social Security office, an increasing number of calls are actually much more in-depth, including explanations about complex interconnections among resources and requesting education about multiple resources and calls, including concerns about elder abuse, neglect, or exploitation. So the Eldercare Locator has been averaging about 200 to 300 COVID-19 specific calls per week since March 16th. That's kind of like our start date for COVID-related things when the call center switched to telework. The highest number of calls have been about stimulus checks and access to home-delivered meals. And in normal periods of operation, about 20% of our calls are about transportation. But we have seen a significant reduction, obviously, since March, but a large group of calls that we get is about home and community-based services. So assistance with chores around the home, personal care activities, home health care services, and financial assistance. Those are all top reasons for calls. And as you can see from this list, our specialists also receive frequent calls about home repair and modification, health insurance, nutrition, legal assistance, medical services and supplies, and caregiver resources. So we are definitely prepared to answer a range of questions about resources for people who have paralysis or need resources to remain independent at home. So though AAAs represent our most frequent referrals, the Eldercare Locator also refers to many other agencies. Just to highlight a few listed here, Aging and Disability Resource Centers. I mentioned Centers for Independent Living, Adult Protective Services, Social Security, Medicare, Medicaid, and Veterans Caregiver Support Line. Those are all the ones listed here are frequent referrals, but those are just to highlight a few. All right, so while many Eldercare Locator users prefer to connect with the specialist directly, many people prefer to access our website. It is eldercare.acl.gov, and it changed recently within the last year, so make sure if you have it in favorites from long ago, you update it. So to get connected to their local agency, aging and disability support resources. So just by entering a zip code or city and state, one or the other, on our website landing page, the user can access the list of key local organizations to connect them with resources designed to help with various home and community-based support. So, I mean, for professionals in any field, it's so frequent that we get questions, or even just from family members, or if they know that somebody has certain local programs and services that they're getting, but they live across the country. You can always just pull this up quickly, plug in a zip code, and get the AAA for wherever you're looking. So I'm going to just want to make sure everybody's on the website. I'm assuming if you're on this webinar, you have access to the internet, but if you can just take a second to go to the website. There's 3 components that I'll be reviewing today. So our database of local resources, educational information and resources, including links and publications. To begin with our most important website component, this slideshow shows our homepage, including a white bar at the top for entering your zip code or city and state. So if possible, please split up now, put in your own zip code, and see what comes up. Note that you can, again, if you're, you have to actually click on the tab if you want to put a city or state instead of a zip code. All right, so once you've pulled up the contact information for your area, you'll see some or all of the 9 possible resources available on the Locator's database for every community in the country. So these are, you'll see right at the top is always information and assistance, the Aging and Disability Resource Center, an area agency on aging, the Title VI American Indian, Alaskan Native, and Native Hawaiian program. A lot of places don't actually have those, so they wouldn't be listed in that case. And then State Unit on Aging, Elder Abuse Prevention. These last 4, I definitely want to make sure people are aware of and actually scroll down to see, because sometimes people just don't go down that far. But certainly Elder Abuse Prevention, Health Insurance Counseling, Legal Services Programs, and also Long-Term Care Ombudsman. So those are all so important. As you're talking with people, if you yourself are experiencing something that you just need to connect with a local agency, your AAA could connect you to any of these, but you can also find them very quickly right by putting in your zip code or city and state. I do want to mention the the University of North Dakota administers a National Resource Center on Native American Aging, and they maintain the Native Service Locator, and it's linked to the Eldercare Locator website in database entries. So if you have a local, local Title VI tribal agency, it would be listed in the Eldercare Locator, and there would be also a link to the National Resource Center on Native American Aging. And we have that link within our resource listings as well. So it's important to familiarize yourself with each of the resources listed in your planning and service area. Make sure you're aware of all these supports and services available to you. And even if you feel like you don't need it now, or the person you are caregiving for, or the people that you are working with in your caseload, even if they don't need it right now, it's good to just have this in your back pocket. All these resources are critical for eventually you will need them. All right, so if you're not already there, I'm going to be doing several scenarios for which individuals, caregivers, and professionals could use the Eldercare Locator, starting with the first example. So you are an independent 55-year-old living with paralysis in Fairfax, Virginia. You have a sister that stops by weekly to help with grocery shopping, some light meal prep, and rides to medical appointments. And you're able to take public transit in a pinch if you need to, though you prefer not to. You would like to know more about food delivery and transportation options for backup in case your sister cannot help as usual, and she's in her late 60s. So I'm sure many of you are having ideas about places to call and things to do. So I'm just going to give an example of some suggestions. Your local area agency on aging and/or Aging and Disability Resource Center is a perfect starting point for these questions. And now that you know about the Eldercare Locator, you pull up the website, plug in the zip code for Fairfax, Virginia, or put in the city and state. You can use 22035, and you can go ahead and find their number. So I have right on their screen the results that you would have for the Area Agency on Aging. If you are pulling this up on your screen, you'll see, as I mentioned, information and referral comes up first, and then as you scroll down, you can find the various resources. One thing you will notice is a lot of times that information and referral contact information is exactly the same for the AAA, for the ADRC, sometimes for the SHIP. But it's still really important to know the different details about your own specific area. All right, so when you explain your interest in speaking with the AAA about food delivery and transportation options for people under 60, they may let you know that while AAAs provide access to many free options for transportation, home-delivered meals, house cleaning, and food delivery, they may have a 60-plus age requirement. However, generally, AAAs also have information about fee-for-service resources, other resources that they can refer you to, and it's a great opportunity to familiarize yourself with other types of services that your AAA or ADRC suggests or offers, since you, or in this case, the scenario, your sister may need them eventually or even soon. So, moving on. So let's see. And I'm seeing a note in the chat, and yes, we absolutely, if you continue to scroll down, I see a message in the chat about the SHIP, and absolutely, we'll be talking about those in the next couple examples. All right, so the next slide, I encourage you to scroll down, just highlighting, just trying to, I think I meant to put in an ADRC, I'm sorry, Aging and Disability Resource Centers. Sorry, my multitasking isn't great. Okay, so if you just scroll down to Aging and Disability Resource Centers, I just wanted to highlight this is a case in Fairfax, Virginia. The listing from the AAA contact information is the same as the ADRC. So as long as your city and town has a listing for ADRC, and many do, you're likely to have some even more success maybe with finding resources to assist with home and community-based services, but it may be the same contact info as your AAA. All right, another scenario. In the next scenario, you are a caregiver for your aunt with cerebral palsy in Atlanta, Georgia. She's nearing 60 years old. You've heard that older adults may be eligible for more free benefits than adults under 60, and you want to learn more. You also assist with managing your aunt's health insurance, and you're feeling somewhat intimidated by all the Medicare information you know you should figure out about before she turns 60. Once you put in your Atlanta, Georgia zip code, and just a tip, so 30322, or you can put in Atlanta, Georgia, scroll down to health insurance counseling. States frequently call their state health insurance assistance programs, or SHIP, something besides SHIP. In this case, Georgia Cares is what they call it, but SHIP offer similar advice and information nationally. So while their focus may be on Medicare, they're also a wealth of information on health insurance-related questions that extend beyond Medicare as well. So in this case, and just pause to make sure you have a chance to look at the health insurance counseling listing on the Eldercare Locator. Hopefully you were able to find that easily. Just keep an eye out for that. I'm calling them SHIP, but in your local area, you may call them something else. And then you may also contact the Atlanta Regional Commission, and that was the first listing that you saw when you looked up Atlanta, Georgia, for their INR, information and referral, their AAA, and their ADRC to learn more about those free benefits in this scenario that you had heard about from other older adults and from friends. So you can also check that out in your search. So the third scenario, you are a discharge planner at a rehab facility near Midland, Michigan. The zip code here is 48640, and you're assisting a 35-year-old man with a recent spinal cord injury to plan out how he will live independently after returning home. So his home is not currently wheelchair accessible, and he will need daily assistance with showering, dressing, potentially meal prep, and grocery shopping, at least initially. So your client has begun receiving Medicaid while in rehab and is due to be discharged within the next couple weeks. So you call your local AAA to inquire about these services, and due to the complexity of the discharge, they connect you with a case manager who can help. So many AAAs have connections to community transition programs that partner with hospitals and rehabs, and even if they don't, specifically partner, they'll likely be very knowledgeable about how to coordinate these in-home needs after the insurance-funded visiting nurse ends. So the AAA will also be able to provide guidance on eligibility and how to enroll in Medicaid home and community-based waivers for in-home assistance, if that's applicable. So these waivers of programs allow Medicaid beneficiaries to access funds that would otherwise only be spent at an institution, ideally allowing people to remain in their homes for as long as they can. So AAAs, even if they don't, do the eligibility and enrollment for a Medicaid waiver service, they're often the gateway for enrollment, or they certainly know how to get you there. So finally, it would be helpful in this scenario for you to connect your client with their state health insurance assistance program again for assistance understanding the nuances of the new insurance. So keep scrolling down again in the Eldercare Locator results for Midland, Michigan, to find that health insurance counseling contact info again. So we see in our Midlands example, it's the same contact information as the AAA, as we talked about before. So this is a connection the AAA case manager could make and probably would, but it doesn't hurt as the discharge planner to also specifically ask about a referral to the SHIP program. And, especially if you see it's co-located there with the AAA, and you just want to make sure that you're connecting your client with the greatest range of services and assistance that you possibly can. Okay. So, and in your process of looking things up, it's quite possible that you found a need for a correction, or you see that your AAA is actually listed incorrectly, or that we've included an incorrect contact info or address. These webinars are actually one of our best resources or sources for corrected info because we have sort of a captive audience of people looking at their info. So please contact us if you do see some discrepancies, And the email is here on the slide, eldb@n4a.org. Please also email me. My contact info is here on the slide. So I just want to make sure to help expedite those updates if you have any to send to us. All right, so our next bit of information here is, I'll just talk you through some of our, the next portion of our website, which is our resources. So as you scroll down on Eldercare Locator's homepage, you'll see 6 photos and resource areas housed there. Support services, housing, elder rights, insurance benefits, health, and transportation. So these are very general resources to help explain key topics that you can use to get up to speed on the types of general needs people have during the aging process. You know, if you are a professional on this call, you probably already know these things, but it's really helpful for people who are new to the field. Feel free to use these for trainings, for staff trainings. We use them with the locator. So each section highlights national resources and Eldercare Locator publications related to each topic. I think most relevant for today, the housing topic has some information about housing modifications, insurance benefits. That section talks a bit about national resources, including how to find your local SHIP, info on Medicare and Medicaid, Social Security and veterans benefits, financial assistance programs, and a tool for maximizing your benefits. There's a link to benefits checkup. And transportation is the third one I wanted to highlight. General information about various transportation options, what to expect if you recently gave up driving, how to approach finding transportation, and also a connection to the National Aging and Disability Transportation Center. That's a program administered also at N4A, and it's focused on organizational and systematic improvement of transportation issues. So for professionals on the line, again, feel free to use some of these resources for training if it's helpful. And the next item under resources is actually scrolling back up a little bit from the previous section on resources, Caregiver Corner. So this is also on the homepage. It highlights 12 common questions that are received by our call center. So some people prefer to read something like this and then not call, but these are, over time, these are ones that we get a lot. So just a few examples, and if this slide might be too small to see, but those 3 examples are, the first question, who can help me with transportation, in-home care, and offering local services such as respite care? Of course, the answer will be your AAA. My father is a veteran. What programs could he or his spouse be eligible for now that they need help in their home? And can I get paid for caregiving? A few more, very relevant to this call. Who can I call for free or low-cost legal assistance? Where can I get help understanding Medicare, Medicaid, and prescription assistance programs? Another, my brother is not yet 60, but he has a disability. Is there a statewide number I could call so I can learn more about programs for people with disabilities? And I'm a caregiver. How do I work with my employer? So many relevant questions. You may even have some of those questions yourself. So please take a look at those. Now at this time, I'm just going to shift to the third and final component of the training, our publications. I have a few examples of our publications and encourage you to visit our website to view all of them. Unfortunately, we're not currently sending hard copies because we're not at the office, but all of them you can download and print if you're interested in seeing more, in handing them out. So the 2 coronavirus publications, this is like entirely too small to see on a slide, but I'll make sure that the links get out to you for these. The publications, a lot of them on our website and the coronavirus included, they're customizable. So a AAA or other organization, if you like this information and want to just put your branding on it and send it out, you can do that with one of the versions of this. Towards the end, you can put in your own logo. So staying safe at home during COVID-19 and it's basically general information to help people understand the basics of coronavirus and direct them to their local AAA. So N4A got a lot of feedback after we sent this out. So many AAAs got this and sent it out as part of their, home delivered meal information campaign. They didn't have to create their own. They could just, co-brand, put their logo on, and move ahead. And then similarly, coronavirus publications, staying connected at home during COVID-19. This one just came out last week. So we developed this one in partnership with Engaged, another N4A program. And as I mentioned earlier, you can kind of see the headings maybe here, but the creating connections without technology and creating connections using technology. So for example, there's a stuck at home guide that's highlighted on this, how to get online, attend virtual concerts, museums and tours, volunteer ideas, and also virtual fitness classes. And then throughout the flyer, again, there's links and contact information about even more ideas on the Engaged website. A couple more examples here. Modifying your home for healthy aging is all about making small or large changes to help ensure people can remain at their homes for as long as possible, and also preventing falls at home. And I'm going to go through these kind of quickly. I'm aware of the time. Our next couple, transportation options for older adults and people with disabilities. That was produced by the National Aging and Disability Transportation Center. And there's just a lot of intro and basic information about what types of transportation are out there, what to expect, and then, of course, as I mentioned, the systematic and organizational change with transportation. That's a focus that our NADTC program works with quite a bit. And then caring across the miles. So that's just a little teaser section of publications. If you're interested, go ahead on our website. This next slide gives you kind of like the step-by-step on how to find all of the publications by going to our consumer publications at the very bottom of our website, our initial landing page, finding helpful resources, all of our publications, and then brochures and fact sheets. You can find our info. And we will be adding a COVID banner pretty soon. I'm pretty sure in the next week or so. We hope to have all those flyers easily accessible right on the locator, top of the locator website. And just a very quick word, I mentioned NADTC already, the Transportation Center. Dementia Friendly America is another N4A program that N4A administers. So it has over 40 national leading organizations, state and local agencies, and individuals are part of our steering committee. So DFA seeks to ensure that communities across the U.S. are equipped to support people living with dementia and their caregivers. And dementia-friendly communities foster the ability of people living with dementia to remain in the community and engage and thrive in communities that are informed, safe, and respectful of individuals with dementia and their families. And then the Engaged I mentioned already. And finally, our Business Institute, Aging and Disability Business Institute, their goal is to build and strengthen partnerships between community-based organizations and healthcare systems through improved and increased access to quality services and evidence-based programs. So as you can see, there's many kind of a range of things that N4A provides, and we all are able to bring our information together for a lot more support for not just our members and AAAs, but older adults and people with disabilities who are calling the Eldercare Locator. And our goal is to really support the community organizations the best we can and just get people to the resources that they need. So I have, next is questions. So I want to give people a minute to send me some questions in the chat. I'll do my best to answer them. And while that's happening, I don't want to rush anyone, but I'm just going to have our contact information up just in case you need that. All right. So, and just to answer a question that I see, yes, the slides will definitely be available after the presentation. I've included a the notes, the lots of information that I've been talking about in the notes as well. Just thinking that maybe some people won't be able to make it on, or it's always can be hard to listen to the entire recording. But all right. So I see there's many questions already. All right. All right. So the website. Okay. So that was long enough ago that I think hopefully people found the website. All right. Well, I don't see any questions popping up. It seems like thanks to everyone who kind of jumped in and answered questions. I was not looking at the chat throughout the discussion portion. So thanks for jumping in, and it sounds like people had their questions answered. But anything else? So we are, as I mentioned, with the COVID-19 resources, both for N4A and the Eldercare Locator, we are always on the lookout for innovative practices. We have not only the listings on our website, but we send out blasts about, to our members and friends of N4A, just to kind of keep people up to speed on what other AAAs are doing. So, keep an eye on that, the N4A.org COVID-19 resources. But also in the Engaged website, there's a section for additional resources, and I'll send the Reed Foundation. Certainly the links to the COVID-19 flyers, but then also some of the links that I've talked about within this presentation, like the Engaged site where you can find listings of other innovative practices, and also N4A, they have a grab and go kind of themed off of the home delivered meal, congregate meal pickup. Just ideas for, quick reference on ideas that other AAAs have come up with. So I'll send those few links out too, along with the presentation. We'll get those to you too. All right. So Centers for Independent Living not included in resources. So my apologies for not highlighting CILs enough. So we generally have, when people call the Eldercare Locator, we provide them kind of across the board. We generally provide them with their AAA, but we also, if people are saying that they're a younger adult with a disability, if they're specifically looking for transportation, we do provide them with their connection to their CIL as well. So I'm not, yes, resources. I'm wondering for resources. Oh, are you asking about, maybe you can just send another message, Kelly Elkins, about which section you were wondering about, was it the website resources, or publications and brochures? I think maybe, one of the questions, the 13 questions that we have. And I'm also very happy to have follow-up conversations with folks. We just like every INR in the world, we're always working to improve our connections, and I think this is a great opportunity. If you're seeing gaps in our resources, if there's ways that we can provide better training to our staff, we're wide open to those suggestions. So by all means, please, let's connect after, because I definitely want to make sure we're providing everything that we can to people. All right, well, I don't see any other questions, and I thank everyone for joining, and yes, coordinators, do you all have any, Julie, or any other
No, we're good. I just want to remind everybody that this presentation is being recorded, and we will put it up on our YouTube channel by the end of the week, and we will also email all registrants the link to the presentation as well.
Alrighty, thank you so much.
Thanks everybody for joining us. Have a great day. Stay healthy.
You too. Bye-bye.